Hey guys, in today's video I'm just going to talk a little bit about my top surgery experience with Dr. Raphael and at the American Institute for Plastic Surgery. Basically just if anyone's looking at possibly going to Dr. Raphael for your surgery or just trying to do research on all the surgeons, trying to pick a surgeon or anything like that, this would probably be a video for you. I had surgery with Dr. Raphael at the American Institute for Plastic Surgery in Plano, Texas, 22 days ago. Right now my shirt looks a little bulky in the chest area because I am wearing gauze under my compression shirt. The reason I want to make this video is because I see a lot of information out there about Dr. Garamoni in Florida and not much about Dr. Raphael. And like a lot of people, my first choice was Dr. Garamoni because I've heard a lot about him, heard great things, and I know a friend who went to him for their surgery, so it's just kind of one of those things where he was the only one I really knew of who does this surgery, and I've heard a lot of things about. But I ended up, because of travel, we'd have to pay for a hotel, and we'd have to pay for the plane ticket, and just I wouldn't be home, and sometimes recovering at home feels a little bit better. I just wanted to look at all my other options, and I kind of just typed in top surgery, FtM top surgery Texas, and Dr. Raphael was one of the first ones that popped up. So I went and onto the site, and there's a lot of information on the site. There's information about the procedure, there was information about Dr. Raphael, there's even a little video that was like get to know Dr. Raphael. There were previous surgery results that looked really good, and there were a lot of patient reviews that were all really great. So I was like, okay, this looks like a pretty good one. I'll actually put a link to that website down below if you want to check it out. So one of the things I noticed on the website was they said they don't use drains for their procedure, which was really interesting to me because I'd never heard of top surgery without drains. I really had no plans in the beginning to look for a surgeon without drains. I didn't even know that was possible. After hearing some of the people who had surgery around the same time as me talk about their drains, it was really nice not to have drains. They just sound really annoying and all that. And it's actually probably something I would have preferred if I had known that was an option, which I didn't. I just happened to go with that surgeon. Just happened the surgeon near me did not do drains, which is really cool. And a lot of people have been wondering how he does no drains. The way he explained it to us was that the space that's usually left in the chest where the fluid drains, the way they do their surgery at the American Institute for Plastic Surgery, that space doesn't actually exist. There's no space in between there. And I don't know exactly how it works, but basically that's how they don't do drains. There is no fluid that drains in there, so there's nothing that needs to drain out, which is a question a lot of people have. That's a really bad explanation of it, but he did explain it to us. We asked, and he explained to us how it works, so that's a little kind of rough explanation. When I went to him, I had first a consultation, then I had a pre-op appointment, then I had my actual surgery, then I had a 1-day post-op appointment, a 1-week post-op appointment, and a 2-week post-op appointment. Now I don't have to go back for 3 months. He definitely will work with you if you're out of town. The nurses and everyone always would either ask or check and be like, oh, so you're in town, and they would kind of make their decisions based on that. So if you're out of town, they'll know and they'll work with you and all that. The nurses were really, really nice and great. They all were very... I think one thing, just it being a plastic surgery center, they're not actually ever working with people who like need something really for medical reasons. It's usually just something physical, it's something that make that person happier with their appearance, and that's basically what top surgery is. It's a real necessity for for an appearance that fits what you feel. So I've heard stories of people who've had surgery in a hospital kind of feel like they were treated like their surgery was less important than the other surgeries going on around there that were misgendered or stuff like that, and none of that was ever even close to happening at the American Institute for Plastic Surgery. All the nurses and Dr. Raphael were all really, really awesome and great. I never felt like uncomfortable. I never felt like they didn't see me as a guy. They would talk some about their previous patients. They'd be like, some guy came in here, some guys come in here, like they'd start out a story like that, and I always felt so included and so comfortable and just respected with my gender identity and all that. It wasn't even an issue. I felt probably the most comfortable with how they just handled that and just knew I was a guy, like no questions asked. They knew I was a guy and I needed this surgery so that I have the chest that I feel like I should have. It was probably like almost just like if I were going in for gynecomastia or something like that, like that's how I felt. It was treated so normal, and that was awesome. Don't know how else to say that. Dr. Raphael himself is a really cool guy. He's really nice. He likes to make jokes, and he loves his job, and you can tell, and that makes it all feel really good. I remember when I went in for surgery, he asked me if I was nervous, and I said yeah, and he responded with me too. So if that tells you a little bit about the kind of guy he is. The whole time I felt really, really comfortable. I mean, they draw on your chest, and they take pictures, and all that time I was always treated with a lot of respect, and I can't really speak highly enough of my experience with both Dr. Raphael and the American Institute for Plastic Surgery. The way it was set up, they had where you do all the consultations, pre-op and post-op appointments on one side, and then they had the actual surgery center on the other side. After surgery, they use pads, actually, maxi pads, to cover up your incisions for like a week or two. And they use gauze. I didn't have any like special, like you know that sometimes you see the raised padding stuff on the nipple. I didn't ever have that. They give you a full chart of all your everything you need to know. They go over everything with you multiple times. There really wasn't many confusions. They always ask if you have any questions. It was just a really, really good experience. When I went back for my 1 week post-op appointment, actually, they handed me a letter, and I had no idea what it was. It was in a little envelope, and they said I was told to give you this. And I'm just kind of like sitting there, and I'm like wondering what it is. Do my post-op appointment and go into the car. As soon as we get in the car, open it, I'm like, oh, it was the letter saying that I had top surgery, officially saying that I had top surgery, and that if I want to do a gender change or whatever, if I need proof of a surgery, that was the letter. I mean, I know I didn't ask for that. I don't think my parents even asked for that, so I just didn't even cross my mind, since I'd already done a gender change in Virginia, even though it got changed back, but that's not for here. I wasn't even thinking about that letter or anything, or if I might need that letter, or asking about that letter, but they already had that handled, and they gave me that letter. They do ask for a letter from a therapist or someone, and the procedure, which was double incision with nipple grafts, cost $6,000. But they go over all that at the consult and stuff. I didn't actually see Dr. Raphael until my 2-week post-op appointment, but the nurses were really awesome. Right after I woke up from surgery, the nurses, I was in the little waiting room, and where you wake up, and the nurses are really great. They gave me crackers, ice, water, whatever I needed. I had a little difficulty breathing. They were on top of that. They put the mask on me, and it was just, everything seemed so simple and routine, and I felt comfortable the whole time, and I felt respected, and I really can't say enough about that. The anesthesiologist called me the night before, introduced himself, and told me again what I need to go over with. They'll text you to remind you of your appointments. I don't know what else to say. I don't think there is much else to say, but I really have nothing bad to say about him. There are results on his website if you want to see how my results are doing. I have another channel where I post my transition updates. I'll put the link to my top surgery playlist down below where you can see all my results and updates. I'll also put the link to some of the information on American Institute for Plastic Surgery website. I'll put the main website. I'll put Dr. Raphael's information. I'll put the FtM top surgery page, like all those down below if you want to see any of those. And if you have any more questions about Dr. Raphael or my experience, please feel free to reach out to me either on here or probably Tumblr would be a good place to reach out to me. I think that's about it. Don't think there's much more to say. May have forgotten some stuff, but please feel free to ask me if I have. Alright guys, I love you all. I'll talk to you soon. Peace.